Okay, well, I'm just introducing you to Hank, who is a dearly loved little budgigar. He's a male, he's about 13 and a half years of age, and he has featured elsewhere on this website, or will feature elsewhere on this website, and in my new budgigar health book. Hank is presented today because of continuing abnormal behaviour. He hasn't been flying around as much in the past week or two, and in the last 2 or 3 days he has started, or has been noticed to be tilting his head more to the right more often than normal. So although he can tilt his head over to the left, as you just saw there, he is tending to look more as look upwards with his left eye like that, a lot more than usual, and have a right head tilt. You can see he has feather loss down the ventral abdomen, and there's a lot more feather loss elsewhere, and that is associated with chronic Psittacine Pruritic Pollyfolliculosis, which has been controlled but not cured by holistic health. He also has a bulge in the ventral abdomen, which is consistent with a mobile tumour, benign, under the skin. It slides around under the skin and over the abdominal wall, and we've elected to monitor it and just help him as best we can without surgery at this time. So I'm about to examine him and see if he's got any signs of an ear infection, see if his eyes look normal. They did a few days ago, as far as I can tell, on a bird the size of a budgie. And I will also do a crop and fecal smear and gram stain smear to see if there's any signs of abnormal bacteria or fungi multiplying out of their usual numbers in excess of their normal numbers. We'll see if there's any other findings I make. Some of the causes of head tilt in budgigars, particularly older budgigars, include stroke-like syndromes, and that can be an aneurysm, it can be a hemorrhage, it can be an embolus or clot blocking a vessel in the brain. It can be an infection getting into the brain, be it bacterial, fungal, occasionally viral, occasionally protozoal, rarely. It can be a brain tumour or a brain cyst, and it can be a range of degenerative disorders in an old budgigar, equivalent to Alzheimer's and those sorts of things. Anyway, we're going to have a look and see what we can do to help him. And of course, we start by wishing him well, and I start by inviting help from my so-called unseen friends to guide me through love and gratitude for the help we're about to receive. Thank you.